respected Vice Principal of Fakhruddin Ali Ahmed Medical College, respected teachers, other dignitaries, and especially Department of Biochemistry for being given me this honor of talking in front of such an august gathering. So it might seem a bit incongruent that a psychiatrist is talking on a biochemistry CME. Well, the theme bridging the gap between clinician and biochemist could be the reason for that. This is the screenshot of a coverage in the Outlook of last 5th of September, mental health. So here you can see depression, anxiety, and burnout. These terms may be common knowledge to the doctors, but when it comes to their own health, these symptoms are often sidelined, and so that they can focus on healing people and saving lives. So I have come up with few of the latest research conducted across the globe, and special emphasis on mental health of medicos, which is one of the most neglected part, and I'm going to shed few light on this. So World Health Organization defines mental health as a state of well-being in which the individual realizes his own abilities, can cope with normal stresses of life, can work productively, and is able to make contribution to his or her community. So basically, a mentally healthy person can enjoy good relationship, he can think clearly, can cope with the stresses of life, can solve problem, and can work productively to make contribution to the community and to the society. So, as if I talk about the well-being, mental well-being, it's a combination of how we feel and how we act. And this is not just a binary system of presence or absence of an illness, but it is a spectrum. So, before I make my voice, I will be just recapitulating our few of the knowledge of physiology, that we can see that our human brain is basically, phylogenetically, this is three parts, and that is the archicerebrum that we used to get in reptilian brain, and that can control the very basic functions of the species. The paleocerebrum, what we call the limbic system, and this is the area of the brain that is related to what I'm going to talk right now, that is the emotion. And the neocortex, as you know that we have landed on the moon, we are making our voyage into the Mars, all are because of this part of the brain. So here is in brief about the functions that I already have explained, these phylogenetic areas of the brain. So we try to comprehend this fight or flight response before we go further deep into the topic of stress, anxiety, and etc. This fight or flight response is a survival instinct that each and every species is equipped with, that whenever they are subjected to any threat, there is a fight or flight response, and that is the activation. And we'll be seeing how this activation occurs and how this fight or flight response is related to our mental health and diverse number of physiological and pathological health conditions. So we have an innate mechanism that our fight or flight response sometimes gets activated. Like if a person, a human species or monkey species sees a snake or snake-like slender object, they instantly develops a fight and flight response. And we are going to the mechanism how it happens. So this fight or flight response, these phylogenetical parts of the brain, all are basically related to our emotions. And our emotion could be happiness, sadness, contempt, disgust. All these are emotion, and we are going to see how this emotion in a human brain is regulated. So here is about few types of emotions like fear, dislike. These do not need our cognitive processing. There is a shortcut. We can see, this is a very important diagram we can see that whenever we see a snake, the inputs ultimately goes to the thalamus to the visual cortex, and visual cortex to the amygdala. Then this amygdala signals downwards, and it activates the neuroendocrine system. And we are going to see how this neuroendocrine system interacts. And here is a shortcut from thalamus to amygdala before it reaches the visual cortex. And this is the reason why and how sometimes without the presence of a snake, if we touch something, some elongated or cold object, without the input goes to our cortex, the fight and flight response sets in. So this is the simple about how our endocrine systems are operated. So whenever there is a fight or flight response, the signal mechanisms comes from the amygdala, and it gives the signal downwards to the brainstem. And from this brainstem, this neuroendocrine system gets activated. Cortisols, epinephrine, norepinephrine releases and prepares the body to cope with the stress of fight or flight response, and simultaneously it activates our autonomic nervous system, mainly the sympathetic nervous system. So this is how our sympathetic nervous system is associated with our emotions. That is the gas pedal. Sympathetic system is the gas pedal, and the parasympathetic system is the brake pedal. So with that concept, we are progressing further. So this is the parasympathetic system, while we feel feed or breathe and rest, and whenever there is fight on flight response, this sympathetic system gets activated. So we have just recapitulated our few of the concept of physiology. So what happens in anxiety? Now I am going to correlate. Now I am going to draw a link between this fight and flight response and anxiety. So whenever there is sympathetic activation, we used to have this. We used to get anxious. Our pupil gets dilated, tachycardia, tremor, sweating, raised blood pressure, accelerated heart rate, and all these signs and symptoms are seen. So this is how all this system used to interact. And this is from the Journal of American College of Cardiology. And this is the mechanism of chronic stress. And stress, as we all know, when we are subjected to some unfavorable life situations, that the response is called the stress. And this is how the stress and our physiology is related. So whenever we are in chronic stress, there is or affective disorder, it causes activation of our hypothalamo-pituitary axis, HPA, and sympathetic nervous system. It causes altered behavior, and all these things are related to our autonomous nervous system dysfunction, that is insulin resistant, central obesity, hypertension, inflammation, platelet activation, endothelial dysfunction, ovarian dysfunction, decreased bone density, and lots of somatic effects. And these are very dangerously related to our health, and how we are going to see. So this is very astonishing to know, and the source is the Journal of American College of Cardiology. Actually, they have found correlation of carotid plaque formation with marital satisfaction. This is very important. So they have seen the initial records where it was seen that the carotid plaque formation was less in satisfied group of individuals than unmarried, and high in low satisfied or having marital dispute. And all these groups were followed 3 years later, and you can see the significant change. So this is how stress interacts with our cardiovascular system, it interacts with our immunological system, it interacts with the entire biochemistry. So American Heart Association also says the 6 reasons that promote interest in evaluation and management of psychosocial stresses in heart disease, and that is psychosocial stress. So this is how we are going to talk about Unlike other most of the medical illness where we can trace out a single cause, but in mental illness we find three causes: biological, psychological, and social. These three factors, how these three factors integrate, and how these factors are related to biochemistry. And biochemistry is, if I talk about the biochemistry is the subject that has given us the insight. Previously we thought the psychiatry can be explained with neurotransmitter, but we are now much beyond, we are much deep inside the cell. And now we understood the main mechanism of drug action, that these are not the receptors, these are the signal mechanism inside the cell. And this is how the various drugs give the signal inside the cell, how these signals alter the gene expression, and how the products of gene expression are correlated with improvement or deterioration of our mental function. So this is of the domain of the biochemistry. So we can, as I already have told, how this biology, sociology, and psychology interacts, and how this environmental factors, psychological factors, sociological factor has ultimate the effect on gene expression. And that is, it has been found that cognitive behavior therapy and other form of psychological therapies, they also induces the similar biochemical changes in human brain like medications. So if I talk about the causative factors of various form of mental illness, that we can see that the biological factor, and that is the biology, that is the genetic factor, how the genetic vulnerability, drug effects, physical health, etc. Psychological causes like physical health, coping skill, social skill, family relationship, low self-esteem, mental health. Actually, these coping strategies, social skills, family relationships, low self-esteem, actually these are related to parenting. And how the child was attached to the parental figure, and how his psychosexual developmental phases have been developed, and how the coping strategies, life skill been infused by the parents. So all these things comes into being. Then the social factors like peer influence, family circumstances, family relationship, etc., etc. These are also included. So this is a vast topic. So if anyone is interested, Anchor Monday is our YouTube channel, and there are lots of academic resources over there. Now coming to the ultimate topic, there's a mental disorder. So before I go to the mental health of the medicos, I would like to give a brief overall picture, overall global scenario. And that is, the mental disorders were the second leading cause of disease burden in terms of years lived with disability, along the top 10 killer diseases, top 10 disabling diseases, and the sixth leading cause of disability adjusted life years. And this report was of 2017 and published by the World Health Organization, and this poses a challenge to the healthcare system, particularly in low and middle income countries. In 2017, 193 million people had mental disorders in India, and this, and we do not know till what level it has reached right now after 5 years. 45 million with depressive disorder and 44.9 million with anxiety disorder. And the disability adjusted life years in India, which was 2.5 in 1990, it went to 4.7 in 2017. So coming back to our main topic, that is so alarming, that is so dangerous, that a general magazine has featured this mental health. Doctor in India have a common tale to tell. So depression, anxiety, these are already very well-known terminologies, and most of the medicos are well aware of. But I am going to talk about the subtle form of the issue where most of the medicos are subjected to, and that is the burnout. And this burnout is a work-related stress syndrome resulting from chronic exposure to job stress. And the term was introduced in early 1917. And approximately 1 in 3 physicians is experiencing burnout. This is very revealing fact. And this may not only interfere with well-being, but also with the quality that is delivered to the patient. This is not only restricted to the medicos, this is not only restricted to the doctor, but this is also linked with the quality of care that is being delivered to the patient. So if we see the PubMed searches, we can see a steep increase of this term of burnout between 1970 to 2019. And critical care consultants, critical care doctors are mostly burned out, followed by rheumatology, infectious disease, pulmonary medicine, family medicine, internal medicine, pediatrics, and emergency medicine. So burnout has been shown to occur in, basically it occurs in all kinds of jobs, but the incidence seem to be higher in physicians. There are some gender differences and interest, and it seems that male physicians are less likely to doubt the quality of their work than women. So if I talk about the symptoms of emotional exhaustion, feeling overwhelmed most of the time, depersonalization. Depersonalization means as if someone is feeling detached from the body or feeling detached of his thought. He's so exhausted, he's so overwhelmed that such types of feelings transiently they come to his mind, and decreased effectiveness at work. So burnout seems to occur mainly in professions involving interaction with people, those of the department, those who have to convince people, and such as physicians, nurses, social workers, teachers, meanwhile, and the syndrome has been described in other professions also. So the symptomatology of burnout appear to be rather complex, and the syndrome seems to develop in several consecutive stages, and this has been different in 5 stages, and that is the honeymoon phase. So when a new professional, when he starts his profession, that we call the honeymoon phase, and with this phase they work very enthusiastically. The moment when the stress starts, we call it the stagnation phase, and when the stress becomes chronic, enduring pattern of stress, then we call it the frustration. The phase of frustration comes, and when in stage 4, the full-blown burnout symptom has already been developed, then the patient develops apathy, not interested in work, and his productivity is grossly diminished, and he develops a habitual burnout. And this is the stage where we should drastically, we should very vigorously, we should intervene at this level before it deteriorates further and develops some other clinical entity in the mental health. So from the stage 2, this cardiovascular symptom starts. He becomes unable to focus. He becomes so irritable. Irritability always engulfs our mind, and we used to get angry with the slightest provocation, and then the reduced sleep quality, then lack of social interaction, withdrawn from the society, lower productivity, anxiety symptom, avoidance of decision making. He becomes unable to make any decisions, and changes in appetite, fatigue, headache, and neglect of personal needs start. And stage 3, that is the chronic stress. The symptoms are, this is a persistent tiredness, overfeeling, overwhelmed, procrastination, always neglecting what to do right now. He will delay the work, and a serious form of occupational or social dysfunctional will set on. So resentfulness, social withdrawal, aggressive behavior, apathy, chronic exhaustion, and cynical attitude. Actually, cynical attitude this is the attitude, actually, basically we can say it to be negativity. Actually, what happens in cynical attitude is that the person loses faith on others. This is not paranoia as we've seen in paranoid schizophrenia, that people are hatching some conspiracy. This is not like that, but losing the confidence that someone will be doing, someone is not thinking good for him. Or he becomes something like that, he loses his interest in materialistic things, money or occupational growth, or so decreased sexual desire, denial of the problems. Even if he is having some big problem in front, but he should deny the problem, he is to overlook the problem, he used to feel threatened most of the time, and alcohol and drug. Obsessions, some compulsions, pessimistic outlook, physical symptoms, self-doubt, he loses his self-confidence, social isolation, he develops chronic headache, chronic gastrointestinal problem, GI problem, some will be diagnosing irritable bowel syndrome, neglect to the personal needs, and escapist activity. That means he escapes the responsibilities, and his behavioral changes sets on, and significantly. And in stage 5, there is the chronic sadness, chronic mental fatigue, chronic physical fatigue, and depression. So there is no such diagnostic criteria. The symptoms as I already have told. There is a Maslach burnout inventory. This is the only method we can diagnose this burnout. And burnout seems to be associated with musculoskeletal diseases among women and cardiovascular diseases among men. And the person of burnout or chronic stress will be developing diabetes, cardiovascular illness, and uncontrolled hypertension. Practice of medicine is an unique and challenging. We've seen that resident doctors or trainees they are very prone to develop insomnia, depression, anxiety, substance abuse, and we see the depression in medicos. We can see that 30% depression. They have found that 16.1% had suicidal ideation. Suicide is a stepwise process. Person do not commit suicide abruptly or at once. Suicide is a stepwise deterioration of cognition. Firstly, the patient gets depressed. Then he starts feeling hopeless, helpless, life to be worthless. Then he thinks it is better not to live. Then let's die. Then comes the plan and execution. So it's a long process, stepwise deterioration of mental function. And that all of us should comprehend and should understand. Because of this high prevalence, we see somatic symptoms like insomnia appear early, and social manifestation of depression, as we can see, that is the social isolation, not fulfilling the social obligations due to workload, inability to relate to the family members, neglecting the families. So significant higher risk of dying from suicide, which is the end stages of the treatable disorder such as depression that I already have told. And from 1.4 to 2.3 times that of the average population. In medicos, this is very high. Burnout, breakdown, marital relationship issues are the precipitating factor for the suicide. And this is the common psychiatric diagnosis is depression. Depression is the common cause of mental illness, and this is the reason of the second leading cause of disability as per World Health Organization. So bipolar disorder, alcoholism, substance abuse are very common in medicos. So other important factors that leads to suicide is the litigation. That ultimately it's a cascade of events. First, the development of this subtle form of mental illness, then deteriorating to the very serious form of mental illness, getting socially and occupationally dysfunctional, getting subjected to the litigation and committing suicides and all. And other malpractice notice, consumer cases, income tax raids, these are the other precipitating factors to suicide in medicos. So suicide among the Indian doctors, India has one of the largest number of doctors. And these data is of 2021. And here we can see that 80,000 medical graduates come out every year from 529 medical colleges, but this level is almost 1 lakh right now, as of now. So medical profession is considered as more stressful, but mental health is still a subject of taboo for medical practitioners in Indian context, and that the laymen also have understood, and this was portrayed in Outlook of the last 5th of September. So doctors have a higher risk that we have seen in many studies. So here in this study, you can see the 2.5 times more higher risk of suicide. Doctors are more prone in this study. So this study was conducted by random search of English newspapers from 2016 to 2019. So they have found 30 suicide cases. 18 were female and 12 were male. And we can see that 80% were younger than 40 years of age group. This is a matter of concern, and suicide is the condition of the young adults, disease of the young adults. And 22 were from the Medical Educational Institute, 17 were from South India, 13 from North India, 8 were MBBS students, and 10 were postgraduate students. And among the subspecialties, 6 doctors were from anesthesia. This suicidal tendency is more in anesthetists. And this could be simply because of their access to the lethal medications. Here, of these 30 cases, 17 used hanging as a method of suicide, 8 used medications, and mostly were anesthetists, and 5 jumped from the building to end his life, and 19 of suicide reports about the doctors mentioned that they were depressed. But basically, the fact is, behind every suicide, there is some mental illness. And suicide is a stepwise process. Every suicide completer gives a threat, and each and every suicide threat is to be taken seriously. And 100% of the suicide is preventable. So mental health among issues, if I continue on this topic, we can see that 72.4 making weekly use of alcohol and 30% with an abusive pattern. And this metamorphosis, how it metamorphoses, actually regular alcohol dependence happens actually. Basically the social drinking, or to dissolve the boredom, or to dissolve the anxiety. You know, alcohol acts on the benzodiazepine receptor. That initially the patient of anxiety disorder starts taking alcohol to dissolve their anxiety, but later on they develop a neurobiochemical adaptation. And the situation called dependence happens when a situation occurs that whenever the supply is discontinued, the patient develops withdrawal. So the substance abuse, these are the self-prescribed medication. Mostly we can see the alprazolam and lorazepam. And nowadays, this is very revealing and very sad, very frightening to know that medical students are getting indulged in taking opioids. Cannabis is one of the most commonly abused substance of abuse among medicos and engineering students. But nowadays, there is a surge of taking opiates. And for an opiate dependent, there is almost no escape. So the causes of the risk factor. Doctors are indeed one of the most stressful jobs, and this is due to long working hours. Every time a doctor is subjected to fight or flight response, they cannot balance the family life and their professional life. Irregular working hours, sometimes night duty, evening duty. They are almost by the time they are graduate, they comes out of a medical school, they already have disintegrated their circadian rhythm. And the patient demand and stress of bed working. And this is very interesting. This is conducted by us, Indian Medical Association. What we have found is that 82.7% doctors in India feel stressed out in their profession. And we have found that 56% doctors do not get comfortable 7 hours of sleep, and during most of the days in a week. And 13.7% fear criminal prosecution while practicing during most of the days of the week. And 46% fear of violence is the main cause of stress for many doctors, that patient may beat them, patient may assault them. And 24.2% doctors fear of being sued, and 62.8% doctors are unable to see their patients without any fear of violence. This is a very revealing fact, this is a very dangerous fact. And 57.7% doctors thought of hiring security in their premises or taking a license for the gun. So how we can manage the stress level? So we have to minimize our stress and emotion, and we can intervene at various levels. That is, working in a team is associated with very less stress, and they should come under the banner of some professional bodies like IMA or any other organization or anything, so that if anything, litigation or anything happens, they can be protected or they can be supported. And provide adequate professional and individual risk coverage. We should go for insurance, professional insurance, ensure staff rotation from the jobs, and schedule duty hours, shifts, taking holidays, regular team meetings to discuss the common problems of the working environment. This should be done. Should have frequent family get-together parties. We should give our families. So whenever we give our families, our level of stress is subsided. Early identification of mental health issues and treatment. We also need to intervene at individual level, and not to lose the peace for earning, and maintain regular contact with family and friends. Professional boundaries we should maintain, and ensure the breaks, and take adequate sleep. Discourage self-medications for insomnia. That is very dangerous, and that is very much consistent with the medicals, because sleep is one of the very complex physiology of human brain, and there are so many diverse number of factors that is associated with sleep disturbances. So a mere sleep disturbances, mere inability to fall asleep, or inability to maintain the sleep, or early morning awakening, we should never ever go for the common self-medications. And we should involve in religious and spiritual activities, physical activities, and it is seen that many studies have validated that persons with religious values, persons with spirituality, these used to give a protection from a diverse number of mental illness. When we have the faith in the God, then a religious person does what? He attributes all the bad happenings in his life to the God. Whatever is happened, this is due to the God. And this is a very protective mechanism from developing or being subjected to stress. So we should be connected to people, we should be active, we should take notice of our senses, and we should give ourselves some time and keep learning. We should be curious, we should try something new, and we should give time to ourselves. So a good relationship, a healthy relationship is a protective factor. Spirituality, that I already have told. The changing in work attitude, that I already have told. We should take self-care, and the philosophy. health and medications and the psychotherapy. Mental illness are not the binary system. This is a spectrum. And it is advisable to go for psychiatric counseling, psychotherapies, counseling, behavior therapy, cognitive behavior therapy, a diverse form of therapies are with the Department of Psychiatry. Why the medicos are not getting treatment and why they do not get treatment? This is very important. Is that less than 1/6 of the medicos seek any professional help. And the factors associated is the fear of repercussions. That some person has visited a psychiatrist. Has he gone crazy? So the stigma is still not only with the general population, but also with the doctors. And mostly they suffer in silence because they do not have time, and they do the self-medication and lack of support. And another most important, the VIP syndrome. Actually, the doctors going to another doctor, there's a factor that is related with low treatment-seeking behavior in doctors. Mental illness of the doctors are related to the service to the public because there could be prescription error. When your attention and concentration is impaired, you will be making mistake in the prescription. You will be delaying the diagnosis. Your judgment will be poor. Your critical care and surgery, everything is going to hamper, and you are going to lose temper. You are going to provoke a chaos, provoke a fight between the attendants and the doctor, and you will ultimately be losing your practice. So what is the future direction? Future direction is mental health among the Indian doctors is a matter of concern, and I am concluding. And there is an urgent need of preventive strategies to be initiated both at institution and at professional organization. We should undertake large-scale surveys and descriptive studies among the medicos and access the ground reality. Actually, this is the area where very least number of studies have been conducted. Very less number of resources are available in this domain. And the studies use on the most effectiveness of evidence-based treatment in this group. This proportion of medical students seeking help for mental health is very low, and it is necessary to identify the barriers and find the ways to overcoming them. And research on intervention strategies in the curriculum and organizational structure of the medical colleges is also warranted. And I'll be taking few minutes in this before I show you this video. So what we have the concept of psychiatry ward. Because this is the video, this is the video was mostly shared among the medicos. And this is the concept of psychiatry among them. And this is the reason of all this fragmented service. If I give one example of fragmented service, what could be more stressful for a person having a cardiac event and undergoing a cardiac procedure? And I can assure you, you will not be able to show a single center in India giving discharge to his cardiac patient after a psychiatry follow-up, psychiatric consultation. So cardiologists do not think. Few years back, I was having a CME at Guwahati calling cardiologist actually, mostly cardiologist and endocrinologist, and I was talking about the psychiatry aspect of cardiology. Before I started my talk, everyone was wondering what could be the relation between psychiatry and cardiology. But when I addressed the cardiology from the point of view of this fight and flight response and why some of the hypertension cannot be controlled, and everyone realized. This is my last slide, nothing to be worried actually. Here I would like to say something, I would like to convey to this August gathering, basically. At least this is very good news for us that recent circular on medical curriculum has included lots of aspects of psychiatry in undergraduate curriculum. And this is a very welcoming sign. Because when a doctor, after passing out from a medical school, he goes to community, his 50% of the patient at the primary care level are having some psychological problem that manifests in the form of some physical symptom, bad physical symptoms. And then they realize why we have not attended the psychiatric classes and went to the psychiatric classes. So in this context, this recent syllabus has made a tremendous change. But this is yet to be satisfactory because there is no mention of the marks. 8 to 10 marks of psychiatric question is asked for. And during those question settings, psychiatrists are not involved. During any internal examination, psychiatrists are not involved. So ultimately we can see the medical graduates, they come out of the medical school totally mostly blind of psychiatry. But when they face And this is the reason why the various services, various healthcare services are so fragmented. But if you see the scenario of the United States, we can see that they have integrated psychiatry in the very first year of medical curriculum. They are mandatory. They have to learn about how psychosocial factors are related to our health. Then in Denmark also, they are much ahead. In Great Britain also, they are much ahead. But in India, still we are much better than our previous position. So, respected all, our mental health is not a destination, but it is a process. Thank you very much.
Millions of mind in this part of the country for last 13 years. And with same enthusiasm, same energy, no tiredness, nothing. Always, a smiling face.
Thanks.
It's really appreciable. And somebody, I have learned one thing from him. I have learned one thing, that one has to think big. But Hamid thinks in a bigger way. Borbeta is a small place. Many people compare it with a Kuha Taro Tulana Kore. But Hamid is going to translate his dream to a reality. Within a couple of years, a mini Nimhans will come somewhere here. Publicly, I may not say many things, I shouldn't also, but this is his dream. I appreciate Hamid from my core of my heart.
Thank you, sir.
If I get another Agla Jindagi, मेरी जाए तो Hamid जैसा बन जाऊं.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you, sir. So, if anyone is having some question,
I have a question. If whatever you have said in your presentation was like India has not included psychiatry in the medical curriculum from the beginning actually. So if so it is, I think it should be included from the first year, I think.
definitely.
That you have said.
Yes.
So how this should be started, and what do you think about the psychology and psychiatry?
Yes, it's a very, very important question. Actually, with the Indian Psychiatric Society, actually we are fighting for last 50 years for integrating psychiatry. Actually, we already have various programs like National Mental Health Program, District Mental Health Program, where we should train the physicians. But it has never been successful. So we from the Indian Psychiatric Society, we are pursuing, repeatedly we are pursuing, previously we did with MCI, we are doing with NMCA, and that is the integration of the psychiatry. What we believe is that if we integrate psychiatry in medical curriculum, then only we will be able to produce the basic doctors. And while teaching them the anatomy, physiology, and biochemistry, we should teach them the psychology. How this psychology interacts with our physiology. Then, in second MBBS curriculum, psychopharmacology should be a separate subject. We should read psychopharmacology in a different way. Then, in clinical, when this is third professional, we should integrate psychiatry as a individual subject. We can replace some other subject, and psychiatry should be given the equal importance, and the graduates, undergraduates should be given the clinical exposure like other clinical subjects like general medicine, obs and gynae. So thereby, in this way only, we can integrate psychiatry into the general healthcare. We cannot train already those who are doctors, those who are posted elsewhere, and this has never been a successful. But we should remember is that in India, every 4 minutes someone is committing suicide. And if we see the anxiety, if we see the incidence of depression, if we see the very wide spectrum of mental illness in childhood age group, in adult age group, if I talk about the schizophrenia, schizophrenia is one of the most dangerous disease entity a human can ever have. Our society is not aware of, because our doctors are not aware of. Doctors are not given the exposure of one of the most important function of the most important organ system. So this is my comment. Sir.
Being an anesthetist,
Sir.
definitely, this anxiety problem is always there.
Yes, sir.
In relation to the patient, actually.
Yes, sir.
So, in our pre-operative checkup, do you give any sort of tips so that we can reduce the anxiety of the patient? Because we are always using anti-anxiety, means mirazolam or alprazolam like this substance.
It's a very important question, sir. Usually when we will be sedating, we will be playing with benzodiazepine receptors. And I'll be suggesting you something that acts on a ACE1 receptor. If we go for hydroxyzine, market as 25 milligram of tablet, this is having the propensity to dissolve anxiety. You can also go for beta blockers. Usually for dissolving anxiety, we prefer the long-acting benzodiazepines.
How does beta blockers act
Sir?
in case of anxiety?
You see, beta blocker basically it controls the peripheral manifestation of anxiety that I already have told, this sympathomimetic symptoms of anxiety. And propranolol is one of the beta blocker that is having the more propensity to cross blood-brain barrier. So both central anxiety and the peripheral manifestation of anxieties are also.
Thank you very much.
Thank you, sir. Thank you, sir. I suppose there is no more question. Thank you very much. Thank